Hello, my name is Carina Wilkerson. I'm a nurse practitioner at Vanderbilt Medical Center in Nashville, Tennessee. I am currently working with the nurses and the providers, mainly the nurses providing support and education to ensure that they understand the process of transplant pre and post. This was our first run through that was post trial, our trial run. So, honestly, everyone did a really great job. They were very in tune, motivated, excited about the process. So, very focused on each role that everyone was playing. The donor and the patient did really well as well. They did so good during that process. And it was just really a good time to actually see everybody come together and able to go through these steps and processes as we have worked so hard over the last year. So we were definitely able to see all the hard work come to fruition yesterday. To make it very simple and easy, you first have to find a donor. You have to have a donor for the recipient. So you have to go through that process of testing. And then you have to do a series of blood work, organ function tests, looking at psychosocial, dietitian, nutrition, environmental factors all play a role in when you're going through this process. And of course, it's a financial component as well. So actually making sure that we have funds available to be able to perform the transplant. Each patient is, of course, different, but I am very happy to see, especially from my experience in the States, is that the quality of life is improved. And so they're able to go to sporting events and travel with family and not be scared to have to go into the hospital or need medication. So their quality of life, being able to just enjoy family and friends, is really great to see. Some of our patients have gone back to school, or they're working now, they're traveling the world. So it's really great to see that the pre and post of their quality of life before and after. So we are a little OCD. So we like to keep a close eye on the patients, especially at the beginning of the post-transplant. Like the first 100 days is extremely important. So, and then the first year is actually even more important, because you want to continue to monitor the patient and make sure that there's no complications that may arise after they are discharged from the hospital. And then even after that annual evaluation, once they make their 1 year post-transplant, you still have to continue to monitor the patient. So I still see my patients at least every year. I went from every 6 months to every year, just to make sure that the labs are doing fine, mental health is okay, that their organ functions are still doing well. So you still have a little component of making sure the evaluations are completed, but it is nothing compared to their hospitalizations and medications and follow-up appointments and going to the emergency room prior. This group is amazing. You have everyone here is very devoted and are going to work really, really well together. They collaborate very well. They're very devoted. They have a common goal, and that is like the patient, of course, and then like the success of this program, because this is major. You can be able to provide care, life-changing a procedure to people within your own community. So they are very motivated, and you can tell that they are very knowledgeable and educated as well. And they're going to continue to expand their knowledge. They're always wanting to go to conferences. They're always online with us. They're always reading. They're always keeping up with new evidence-based interventions and practices. You can tell that they are yearning to learn more and more about transplant and whatever the best care for their patients. So it's a very great group of individuals.